Hello everyone, my name is Juan Chuan and I am a DMP student at the Johns Hopkins School of Nursing. This presentation is brought to you with the help of my faculty advisor, Dr. Catherine Ling, and Director Rob Carter of the JHH Office of Emergency Management. In this presentation, we will discuss key aspects of communication during an emergency. After watching this presentation, the learner will be able to 1. Understand the chain of custody for communication and connectivity during large-scale emergency events. 2. Identifying the different abilities of key partners in the hospital's emergency operation or major incident plans. 3. Understand the procedure for documenting the provision of care and communicating critical patient information to people transporting patients during large-scale emergency events. 4. Know the process of requesting items from the Strategic National Stockpile. 5. Able to effectively present information about the degree of risk to different audiences. 6. Understand appropriate debriefing activities following a large-scale emergency event. 7. Knowing the use of all types of communication device. According to the CDC Crisis and Emergency Risk Communication, the Kirk Manual of 2018, crisis and emergency have phases, and it's important to understand how communication evolves with each phase. Number 1, preparation phase. During the preparation phase, the hospital will focus on planning and preparing, which includes building relationships within the hospital and community stakeholders, so the nurses will need to know who to work with during a response and get to know and be known by the people you will be helping during an emergency. During this phase, a crisis communication plan is developed, and incident command centers are established to prepare for potential crisis. At the Johns Hopkins Hospital, the communication plan is outlined in the Emergency Operation Plan. Key messages are also drafted for targeted audiences such as patients, staff, and the public in preparation for the most likely disaster scenarios. Number 2, initial phase. This initial phase of the crisis is marked by significant uncertainty, heightened by immediate attention, and scattered information about the crisis. Communication during this phase should aim to express empathy and build trust and rapport, inform affected people right away about who and what is at risk, acknowledge the event, provide information on how to reduce the risk, and establish credibility by explaining what the hospital and each unit is doing to respond to the emergency. Number 3, maintenance phase. During the maintenance phase, the intensity of the crisis subsides, and the nurses can help provide more background information on the crisis to help patients and families understand the hospital's response and plans and explain risks to targeted audiences that may be affected by the crisis, such as elderly and children during an infection outbreak. It is also important to foster public support and cooperation with response and recovery efforts and clarify any rumors, misunderstandings, and unclear facts. Number 4, resolution phase. This phase usually takes time as responsibilities and blame are addressed in this phase. During this time, the nurses may continue to motivate people to take action or remain vigilant, continue to express empathy for those who are still suffering, and promote community preparedness for future crises. Number 5, evaluation phase. During this phase, the crisis has ended, and it is important to evaluate the effectiveness of communication to improve crisis communication and document gaps and communication lessons learned from crisis response. Finally, specific actions to be taken to improve crisis communication and response during the evaluation phase. The Johns Hopkins Hospital will work with several key partners during an emergency event. Within the hospital, the Emergency Manager on Duty, the EMOD, is the point of contact for any emergency that the hospital may face. Outside partners include the Baltimore City Health Department, BCHD, the Maryland Department of Emergency Management, and the Federal Emergency Management Agency, also known as FEMA. It is important to identify each partner's different abilities so that they can be utilized effectively during a response. The Baltimore City Health Department is the primary contact for community-wide incidents. We should reach out to BCHD when Johns Hopkins Hospital has exhausted its internal resources, when specific resources available to BCHD are required, or when external guidance is needed to address a situation. The Maryland Department of Emergency Management, the MDEM, is an agency that coordinates emergency preparedness, response, and recovery across the state of Maryland. They provide information regarding emergencies to healthcare providers as well as the public. The MD Ready is the MDEM's crisis alert system that allows anyone to sign up to receive alerts via text and emails. The Federal Emergency Management Agency, FEMA, is a federal government agency that offers resources and support for disaster preparedness, response, and recovery, as well as issuing alerts and warnings to the Emergency Alert System, the EAS, and social media. FEMA disseminates information regarding crisis to help people understand risks and provide updates on crisis as well as communication guidelines. It is important to familiarize yourself with key partners' communication channels, resources, and information and learn to coordinate with these partners at all phases of a crisis. For documenting the provision of care and patient transportation communication, in the event of a large-scale emergency, it is crucial to document the care provided clearly and concisely. This documentation should cover all patient presentations, and even documenting seemingly trivial details can help accurately evaluate the crisis response during the later evaluation phase. A comprehensive medical record should include demographic data, medical history, medications, allergies, current illness or injury, treatments given, and patient disposition. Patient encounters should also describe the crisis event, including the location, cause of injury, and other relevant information. Nurses can use handheld digital devices such as tablets or cell phone to expedite documentation. When transporting a patient, nurses are responsible for maintaining the confidentiality of patient information. This includes ensuring that all information is shared securely and only with authorized personnel. If a patient is transported to another healthcare provider, nurses must provide a copy of the patient's relevant medical information to the receiving provider. After the transfer, nurses must retain the patient information for the legally required period. The Strategic National Stockpile, also known as the SNS, is a national repository of medical supplies and equipment. State, tribal nations, and territories can use it to respond to various emergency events as needed. The SNS also serves as a buffer when supplies are unavailable or insufficient. The SNS contains personal protective equipment, PPE, ventilators, or various preventative and treatment options for public health emergencies, bioterrorism, or natural disasters. During emergencies, requests for SNS material or other emergency medical need should be communicated via email to the Baltimore City Health Department at bchd-eoc@baltimorecity.gov or by phone at 410-396-3100. For the current Maryland Department of Health Emergency Medical Countermeasure Plan, the Maryland Department of Health will generally ship SNS assets directly to our hospital. However, all requests for other Baltimore City Hospital for emergency medical material, including SNET assets, should be coordinated through the Baltimore City Health Department. Here are some ways nurses can effectively present information on risk to different audiences. 1. Prioritized communication. Nurses should prioritize communication as the initial decision-making process in a crisis, not just after decisions are made. Number 2. Involve communication experts. Involve communication experts during the development of a crisis communication plans. Number 3. Develop a communication plan for crisis. Identify potential crisis, outline risk reduction plans, list available resources, and assign responsibilities and roles to all involved colleagues and staff. Number 4. Build a relationship with key partners. Establish relationship with key partners before a crisis occurs to better understand and reach target audiences. This will ensure efficient communication during a crisis. Number 5. Uphold patients' and public right to know. Provide patient and public with information on the risks of the crisis and action that can reduce the risk. Number 6. Accept uncertainty. Be open to the uncertain and ambiguous nature of crisis and the need to act with limited information and facts. Help explain the measures taken to address the uncertainties. Number 7. Listen attentively. Listen attentively to patients, family, and staff and encourage them to express their concerns. This will help you understand what people think about the risk, which will ultimately help tailor communication strategies and provide reassurance. Number 8. Communicate with honesty, compassion, and empathy. Communicate honestly and be open about the severity of the crisis. Show compassion and empathy by recognizing people's distress and responding with understanding. Number 9. Tailoring the communication to a diverse audience. Tailor communication to a diverse audience by considering the cultural background, language barriers, education, and disabilities and using clear languages, visual aids, and interpreters when appropriate. Number 10. Monitor and adapt. Continuously assess the evolving situation by gathering feedback and adjusting communication efforts to meet the changing needs of patients, families, and the public. It is important to conduct debriefing activities following a large-scale emergency event. This will allow the hospital to identify areas for improvement in its response to future events. Documentations that were made during the initial maintenance and resolution phase of the crisis, as well as feedback, needs, comments, and criticisms from key partners and the public are analyzed. The debrief should include a discussion to review what went right, what went wrong, and what happened during the crisis, and develop a strengths, weakness, opportunities, and threats report, also known as the SWOT report for crisis communication. The results of the debrief will be shared within the JHH hospital, and subsequent changes and improvement will be made to the communication plans and policies, including appropriate integration of necessary training into the policies. The Johns Hopkins Hospital has various communication channels that can be used during an emergency. Rapid acute communication channels such as shouting, megaphone, text and email through the emergency messaging RAVES system, overhead paging, website announcement, alertus message, and press release are used instantly following recognition of an emergency for acute notification to alert persons in immediate danger and communicate immediate actions that should be taken or should not be taken. Secondary notification channels are used to disseminate information to facilitate emergency response and recovery after information has been communicated through rapid acute communication channels. Secondary notification channels include text and email alerts to the assurance system, web notification on desktop computers through the alerters, phone calls, message boards, and website announcements. In the event that primary systems are not operational or available, redundant communication channels such as two-way radios, online virtual meeting rooms via Zoom or Teams, and government emergency telecommunication systems can be used. In addition to the points I have covered today, I would like to include some additional information such as the communication checklist from the World Health Organization for clear, accurate, and timely communication in crisis management. I would also like to share with everyone a number of resources available to help you prepare for emergency event. These resources include the Johns Hopkins Hospital Emergency Operation Plans, the hospital website, the Johns Hopkins Office of Emergency Management, FEMA, MEMA, and BCHD website listed below. And here are the references. I hope this presentation has been helpful. Please scan this QR code to access the post survey. If you have any questions, please do not hesitate to ask. Thank you for your time.